Good afternoon and welcome to another episode of A Contagious Smile, where every smile has a story. Today we're going to do things a little different. We have some individuals who work with the CRPS diagnosis. We have clinical managers and we have a territorial manager who are joining us that are going to give us some insight from the other side and help us by providing some unanswered questions and answers. Now, I also have CRPS. And what a lot of people have conveyed to me is that they feel as if they are unheard when they go to their doctors and surgeons because they're not really getting their answers that they're looking for. Now, I have been working with Tori for years, and she's joining us as well as Marissa and Jen. And I have to say I'm very blessed right now because these are my ladies from my team after my fourth stem router implant. So I'm very, very lucky to have all of them here, and I thank you all for being here today.
Thank you for inviting us.
Yes, thank you for having us.
Absolutely. So for what people don't understand is CRPS is complex regional pain syndrome, and there are two stages to this. Tori, could you give some insight on both of them? And you can even go in and tell them which one I have. I don't care.
Yeah, absolutely. So with CRPS type 1, that's more of in the beginning, the first month to the third month. And then with type 2, it is characterized by the presence of a defined nerve injury. So at that point, it's when we're really pinpointing the nerve that pain is really coming from.
And which one do I have at this point?
Type 2.
Yes.
Stage 2.
Yes, phase 2. Now, these ladies are here out of the goodness of their heart. They do not have a medical degree, but they are professionals in this field. So they are giving you their thoughts and opinions, not medical advice. I just wanted to put that little excerpt out there. CRPS, is this something that anyone can ever get over, or is this with us for life?
Yeah, so from the experience that I've had, right, with working with stem router and peripheral nerve stimulation, we're working to help improve it.
So does this do we have CRPS for life, or is it something that can go away?
It can get better, but it doesn't necessarily ever go away. You can help with the symptoms, help with the retraining of the nerve endings, but it never goes away. It may not have as many times where you're dealing with it, where you can go longer between stimulation sessions, but it never really goes away, because if you exasperate anything, you may have to restart back to the beginning of using the stimulation more and then going back to where you're not using it as much.
Now there are
absolutely.
I'm sorry, go ahead, Tori.
That's okay. My apologies. So to piggyback right off of what Jen said, is helping to help have those symptoms not be as prevalent and at top of mind.
So I understand there are quite a few ways to get diagnosed with CRPS. I was diagnosed with CRPS due to, how do you want to say it, Tori? I'll let you say. Well, what was my reason for getting it?
I think that it's more powerful for you to share your story of the diagnosis with that.
I was in a surgery where I believed I was only having carpal tunnel done. That's what I authorized, was carpal tunnel surgery only. And I came out with numerous surgeries that had been performed without my knowledge or consent, and one of which actually opened up my arm from my wrist up my elbow and up halfway up my upper arm. And I knew within 72 hours something was wrong, and I ended up starting with the claw fingers. Everything felt like it was on fire. It was very numbing. It was painful. It was an unexplainable experience. I went back to the surgeon, who instantly tried to blow it off. I said I didn't think that the scar from carpal tunnel was more than just like a couple millimeters on your wrist, and here I am looking like, you filleted me. And then on top of it, he scheduled another surgery, and did another procedure that I didn't consent for. And then I went to a limb and hand recovery specialist who has been amazing. And give or take the number just for this alone, I'm close to 14 or 16 surgeries under my belt just for this right now, including nerve transposition, nerve transplant. I've had ulnar nerve transfer, the internal fixations. I've had the stellate block. I've had at least 6 or 8 of those, and this is my 4th device. Now, is it common, ladies, for the doctors to even talk about amputation? Because mine have. And if so, when is that decision really a good one to make? That's a really hard decision to decide upon. That's a big thing to hear.
That is, in my background of where I came from, usually amputation is one of the last resorts. It's something they try to avoid. I've been in the OR for 22 years, and it's always something, it's a last resort. They'll do all kinds of other things before they resort to that, usually, from my personal experience.
Right. It was quite scary because
yeah,
they had mentioned it to me originally maybe a year ago, and it was just like, well, worst case scenario, we would look at, an amputation. And I was like, wait, what? No. And then all of a sudden we've done more and more and more. My fingers have pins and screws in them. I have wiring in through them, and they've even replaced some of the tendons in there. And then they kind of mentioned it again, and then they've straightened my fingers the best that they can, even though you look at them and they have hardware in them, they're still clawed. I have partial paralysis. I did do a nerve conductive study. That's not something, I don't know if any of you guys have ever had one. It is not something I wish on any, well, there's maybe a few people I've wished on, but there's not many. I did ask my original surgeon to go do it with me. He refused, but I thought he should have the pleasure. So that nerve conductive study, that is a process where they go in and they listen to the sounds of the muscle and the nerves, and they listen to it and they shock you. And just when I thought that torturous event was over, they did the other arm for comparison. And my study, the gentleman who did it, basically, I could tell in his face that he was pretty shocked, and he basically told me that even the muscle was non-responsive. It was that bad, which was pretty shocking because my background is I was always in the gym, and I was always, someone who lifted weights. I have a long martial art background, and all of a sudden now I can't pick up things with my hand because it drops. I can't hold anything. Like holding a handle of a pot and trying to stir it is not something I can do. So it really does do a lot to you to have to go through the ins and outs of all of this and live life this way. So I've had the 4 devices, 2 of which were temporary, and they came out. They didn't stay in, and my rep, if you want to call her that, took months to try to get me back in to get it fixed. And even when I let her know, it was, I'll let you know, it'd be weeks before I'd hear from her, and I would just send a message saying, do you know where we are with this? I'm trying to, because it's like, and I know you guys could probably explain it better, but when you're getting this electrocution therapy, and then all of a sudden it stops, and it stops for a period of time, it's almost like, I don't want to start this again because I'm getting used to that pain all over, and then you're going to put me back at square one getting electrocuted, because I had gotten pretty high up there on intensity, and then it just came out. So with the CRPS, how do people decide which route to go and how to go with a stem router, and which stem router is best for them? I know that their doctor and surgeon have to put in their advice, and I understand that you guys aren't giving medical advice, you're giving opinion, but what would you guys say to all of my fellow friends that are in these CRPS boats with me?
Well, from my experience, it's usually what that doctor is comfortable with and what they have the relationship with the company. So they kind of pick with what they've been trained on, and what they're comfortable with is how they decide what they're going to use. And then that's usually the route they choose. Or if they see us at different society meetings, different meetings like that, and get more information and do training. And then they kind of pick the one that they're most comfortable with. And it depends on what the patient needs too.
I truly believe that you should thoroughly investigate your doctor, because I've been very, very blessed. The one who did the original harm, no. But the two I have now are phenomenal. They're absolutely amazing. And I have to say that if I hadn't come back to the stem router that you guys represent, I don't know where I would be, because the one that I had with the other company twice got me so frustrated and annoyed. I felt like I didn't matter. And I hear that so often from other CRPS people, that they feel like they don't matter, and it makes them want to give up as well. And they don't want to go down this journey, because, I mean, when they go to the surgeon or even for therapy, they just feel like they're just a number. They're just a case. They're just, you know, when the doctor leaves, it's over and they're not getting their answers. So you guys provide so much information. You provide websites and videos, and I was almost overwhelmed by all of it. I actually watch all of my surgeries. I know it's going to be weird. I literally I've watched every one of my surgeries I've ever had prior to having them. And this actually isn't as bad as a lot of people would think. They keep you awake, which scares the bejeebies out of most people. But do you guys want to kind of tell how it goes and how it's implemented? It really is not as bad as you would hear it from a doctor.
Yeah, absolutely. So to piggyback real quick off of one of the things that you just said of being heard and being listened to and not just another number, I feel so fortunate to work with a product like StimRouter and all of the different patients that I have the opportunity to interact with the physicians as well. But I say to every single one of my patients that I work with, we're a team, right? You have my cell phone number, you call me, you text me, we're a team in this. I'm here with you on your journey, right? I will do anything I can in my power to help you, listen to you, and anything possible that I can do. The procedure itself, there's two different ways. So the primary way that I see is done percutaneously under ultrasounded guidance, right? So the doc will numb up the area really well, not putting local next to the nerve, because throughout the procedure we do interop testing to make sure that they are right next to the nerve and the patient feels the stimulation traveling to the area that they're having pain. It's covering enough of their pain. So the implanted component is a 15 centimeter lead with platinum iridium wrapped in silicone. The only non-insulated components are the 3 electrodes and then the receiver. The electrodes go next to your nerve. The receiver goes right underneath the top of your skin and your subcu, and then you have an electrode and an EPT that will lay on your skin. It's not on there 24/7. The stimulation will stay on for 4 hours. There's no right or wrong level. It is whatever feels best for the patient, whatever provides them the most relief. But back to the procedure itself, right? So it's done percutaneously under ultrasounded guidance. So everything is hyperechoic under ultrasound, so the physician can see all of the different tools, can visualize the nerve and see exactly where the lead is next to the nerve. We are able to test it every single step along the way of the procedure to really ensure the best outcome, the best feedback from the patient, and essentially for the best experience all around for everybody involved. And then, right, so the procedure, it's done. Usually the patient is awake with the area really numbed up. And then do that. And then afterwards, we would meet the patient in PACU, do what we call programming, which is educating the patient on how to use the device, figuring out the best stimulation intensity that provides them the most relief. We have the ability to put 8 different stimulation intensities on the patient programmer or remote, which is really amazing, right? Because hypothetically, right, I check in 3-4 months down the line and I say, Mr. or Mrs. Smith, how's everything going? You know, Tori, the stimulation is going well, but I would like to try a different frequency or something like that. No worries. You have the freedom and flexibility and control to do that right at home. Jen, is there anything that you think that I missed that maybe I could go into more depth with, or anything else that you would like to add?
No, I think that's perfect, because what it's doing, it's putting the control of pain relief in your hands. You're not relying on someone else to change anything. You can change different intensities that we kind of set with what your pain threshold and different things are to make sure it's catered to you. It is your specific program. No two programs are the same. So what may work for one patient doesn't work for the other. So we try to go with what helps cover the pain to where it's going by stimulating that nerve and breaking that response to the brain. So then you also can control not just changing the programs, you can change intensity on the program you're using. So one day you don't need as much, you can turn it down. The other day you can keep it up if you're having a bad day, within that 4 hours of your stimulation session. So I think that's what's amazing about this, is you're in control of your pain relief, and you can still do what you get back to that active lifestyle, to get back to what you enjoy.
That's amazing. Do you guys have any favorite patient stories that you want to share that gives others hope that's listening, that's maybe contemplating whether or not that they want to actually go through this?
I think your story alone is huge. And I think, just you being able to be you again, and what you've gone through with that possible amputation that they were talking about, to now you can actually do your day-to-day normal stuff. I think that itself is a patient success story. So I know there's other ones out there, and we can share the website if you want with your people and stuff, and they can look at all the other stories. There's so many stories. I know we have a CHP officer from California that's retired, who couldn't do anything. She just wanted to ride her motorcycle again, and she can now do that by using the stimulation over the years. She's now to the point where she's enjoying riding her bike again.
Like I said earlier on, I met Tori years ago, and she actually met up with me how long after the surgery? It wasn't that long, maybe 6 months or so, maybe, right? Is that about?
I believe, it was around that time.
And we met up for coffee. My daughter was just ecstatic to be up there at coffee. And Tori sat with me for hours, trying to do all different things. And what happened was that it was not a fault of the unit or the device, is that we had found out that somehow in one of my many, many surgeries that it got moved, if I'm correct, or something nudged it during a surgery or something, is my understanding, and it took it off base from what it was supposed to be doing, and it wasn't working any longer. So I've had it all those years, and just in this last surgery that I had, that Tori was in there with me, you also probably will recognize Tori's voice. She did a video with my surgeon that people just think is hysterical, that you can see on YouTube, and I'm thinking of putting it on TikTok just because it's fun. But that it took me up until this last surgery, and they removed that wiring. What happens to all the wiring if you stop using the device altogether?
Nothing. You can keep it in there you don't have to remove it. It can stay there. And then down the road, if you have a flare up, you can charge it up and use it again, but it does not have to be removed. It's a permanent implant. So it can just stay there, not using anything externally. And then down the road, if say you go out on the town or something, you're going to aggravate it, you can charge up your system and proactively use it again.
Now, how long will the other system be good for? How long will it work for?
We've had them for 5 years. All you have to do really is change that. There's a rechargeable battery if we need to, because they have a shelf life of about 1.5 to 2 years. Change the battery is about the only thing we're seeing. And if anything does happen, we have a wonderful tech support that will help troubleshoot if we need to figure out any other things.
Now, I know that what are some common questions that people ask? Because I've had a lot of people that I speak with in groups that'll say, oh, you had this, doctors mentioned it, but I'm very hesitant because they didn't give me a lot of answers to my basic questions that I had. And I know I can tell them, but I know that they'd rather hear it from someone on the professional side, not someone on the receiving side, because it's different. Everybody is different. Yep. how they get it. So how about giving us some question and answer time for those that are contemplating getting this?
I think the best one is talking to your physician. And if it does come to it, going to the website, looking at the different questions that are on there and the answers, or even asking the doctor if he can connect you with the clinical person for the implant that you're possibly getting. And then we get calls like that all the time just to answer questions. So we are around 24/7 almost across the country, not always at the same times, but we always have somebody that can answer questions that come up from a potential patient that we can definitely answer because everybody's got different questions. Everybody has different ideas and every patient's different. But, working with a physician, figuring out what the questions are, they can always come to us, the physicians or the patients, if connected through the physician.
How about sharing some of those questions and answers, such as I've had people say, if I touch around the area when you're being electrocuted, can I feel it?
Yeah, so I think one of the biggest things, right, when I'm working with patients and programming them is, well, am I at the right intensity? Am I like, is this right? Is this level right? And to answer that, it's really every single treatment plan is very individualized, right? Like Jen said, no two programs are the same. No, all patients' experiences are different, and all patients experience, like, we really value that and listen and do everything that we can to give y'all as customized treatment per se as possible.
Right.
And to answer your question about that, you don't feel it outside of, it's going straight to that receiver. So it doesn't go to the extra tissue. It goes straight because it's picking up the signal from that, the implant. So it doesn't shock the rest of the area per se.
So I'm asking you because the question I've been asked from other people contemplating getting this, like if their child came up and touched any area around while it's on, will they feel it?
Nope, it's just on that patient because it's going through that electrode, the gel electrode that you stick to your skin. So if they touch just that gel electrode, they're not going to get anything because it's going straight in and that gel is stuck to the skin. So the child touching anything around it's not going to feel anything.
What if the child?
Yeah. So right, if you think,
but
if
the
you
child puts
the
patch on, it's like a TENS unit.
Right. And if we think about a Band-Aid on our finger, right, if you're touching around where the Band-Aid is, you're not going to feel that adhesive, right, that's underneath it. Exactly like Jen was saying, the stimulation is going through that hydrogel, is being picked up by the receiver, right, which is one of the two non-insulated components of that lead. And there's, like she said, no area around the skin that you're going to touch that you'll feel it, unless you slide your finger underneath the electrode.
And you get and you're on that gel itself, you'll feel stimulation, but the child just touching that area will not feel anything.
I've had other questions like, do you sleep wearing it? Is it on while you're sleeping?
We don't recommend that just because you don't want that gel patch on more than 4 hours because you don't want to have any. You want that skin to be able to breathe 4 hours. If you want to set an alarm, you can sleep with it, take it off for 20 minutes and then put it back on. But we don't recommend overnight wear just because we don't want you to have that patch on for longer than 4 hours.
What about?
Yeah, so to go off of wearing it at night when you're falling asleep, right? So we all know our bodies very well, right? Better than anybody else. And we know what feels best for us and what is providing us the most relief. And I like to say I actually said to a patient earlier this morning, right? She was implanted recently, and she said, Tori, like when I'm laying in bed falling asleep at night, like it's just agonizing, and my mind is just so distracted from trying to fall asleep, and I've got all of this scene running through my mind, and it's a constant reminder. And she said, can I wear this while I'm trying to fall asleep? And I said, you know your body, you know what feels best. If laying there at night when you're falling asleep, utilizing the stimulation makes that easier for you, is going to help you get a better night's sleep, please do. But please, please, please set that alarm for 4 hours, or have somebody that is able to peel that electrode off to let your skin breathe, right? Because just like if you leave a Band-Aid on your finger for like a week, it's going to get a little pruny. Same thing with leaving the electrode on for more than the prescribed per se time. It's important to let your skin breathe. Did that answer your did that answer your question enough about wearing it at night?
Yes, I'm just asking questions that I've heard because I know a lot of people don't even want to consider getting this device and then they go hear from the physician or the surgeon and they don't really get their answers. And I'm trying to provide some of just basic questions and answers to make them feel like, okay, maybe I can talk to my doctor about this. I know my doctor is one of those not great bedside manners, but great doctors, great surgeons. So I have enough to go in now. Maybe I'll research it my own and get it. But a lot of people I talk to say, I don't know anything about it. When I try, it's just like, okay, here it is. We'll do surgery, bye, kind of thing. And I'm trying to give them the basic ins and outs and yes and no's so that they realize whether or not this would be a good option for them.
I also think what kind of is a benefit of us is the fact that our clinical team, that's one thing I have worked on, is that we are there for you. Whatever you have questions, text, call, whatever helps, because that's what we're here for. You may not know it may be something that you think is just out of the blue, but it's something we've all been asked before. And that's what we pride ourselves on, is to be there for you, to be there through the process of you learning and getting pain relief and getting back to what you want to do. And that's what I think. I pride myself on making sure everybody does that. So I think, and I think Tori's a wonderful example of that. Like, she takes calls. It doesn't matter if we're walking through an airport or whatever, she'll take the call and answer the questions and help with, and try to meet and help and do what we can.
So
Yeah, and I would just like to add, as a new sales rep, territory manager, now responsible for selling StimRouter and getting it out in the field or market or my territory, working with Tori, to Jen's point, she's always accessible. That's an added value that StimRouter has, is, like Jen said, the field clinical managers that are there for the patients. You've experienced it yourself, Jackie. So, pain is very serious, especially chronic pain. It's very subjective. And like you mentioned earlier, Jackie, some of your concerns may have not been addressed back in the day, or maybe, you felt like you were unheard. And that's what StimRouter is an absolute, it's an awesome option for those patients that have pain at the periphery, that can actually, once you figure out what nerve is causing the pain, it's a simple procedure. It could be perk or open, like Tori mentioned earlier, and it can give you some pain relief that you never thought was even an option. Spinal cord stimulators have been on the market for many, many, many years. It's a much more invasive surgery. Peripheral nerve stimulation is much less invasive, and definitely more targeted, at pain relief, at the source of the pain. So, it's been really unique in my short few months of selling, StimRouter. I think it's awesome. A lot of doctors, their ears perk up and they smiled when they hear it, that this is an actual option. So, for yourself and any of your listeners, if you're dealing with chronic pain, this is definitely an option. And to speak up and ask your physician about it.
Right. Exactly. And I agree with you, Marissa. I think that's sometimes, I always tell my family members, you can ask questions. You can bring things up to your doctors. They don't know everything. So that's what's nice, is if you have some information, you can bring it and ask the questions and start the conversation with your physician, on options outside of what you're currently doing.
Right. So if you're being treated by a specific pain doctor and he or she is not necessarily dealing with nerves or doing, surgeries for nerves, and you're just constantly getting injections, or your opioids are being, refilled, ask that physician, well, is there anybody local or anybody that you have a referral network with that would maybe be interested or is currently doing, implants of peripheral nerve stimulation, and they'll be able to direct you in the right place. We had a patient who was being treated in Savannah, Georgia, for chronic pain, and that physician referred her out to a physician at Emory in Atlanta to be implanted with StimRouter, and she's, now feeling the relief from StimRouter. So, so there's networks. If physicians aren't familiar with it, they might want to become familiar with it, or they might say, hey, I don't touch nerves and I don't do that type of surgery. I can refer you out. So the option to be treated with this is there.
Mm-hmm.
what about, I've been asked a lot, like, I actually, even when I'm talking to people, I will show my beautiful little friend that I have. And mine is, not in the best position, and it kind of gets in the way when I'm getting dressed because it's where your bra is. And I've had some people say, do you feel that on your heart? Does it bother your heart? Can it cause heart issues? What would you guys say to that? Again, they can hear what I say, but I know they also feel more comfortable hearing what you guys say.
Well, like we said, it's only targeting that receiver. It's not going to send that stimulation anywhere outside of that. It's going straight to that receiver because that's what it's made for. The wavelength goes straight to that receiver, and that's where it sends it. It's not going to go. I mean, as long as you don't have a pacemaker or anything like that, nothing contraindication for it. It only goes to that receiver.
I've also been asked, and I had to try to keep a straight face, and I couldn't. But can you take a? I can't even ask a question without that. Can you take a big magnet to it when you shut it off? I was like, I don't know. I haven't tried.
Well, I wouldn't suggest sticking a magnet on the EPT, just because of all the signals and the Bluetooth connection. But if you just stick a magnet over the lead, it's not going to do anything because it's just that wire that receives the stimulation and sends it down. It's not like a pacemaker where you put a battery over it to do surgery, so it doesn't affect anything with the surgery. But just putting a magnet over your lead, it's not going to do anything.
I think people watched a lot of ER or
too much, too many.
Right?
Grey's Anatomy, all that.
And I'm like, I don't know. Like, I don't know what it would do, and I'm not going to find out. I don't want to know because with my life, my life would be
Yeah, I would not. Now, don't put the magnet on the EPT itself, but if you're just putting it over that lead, it's not going to do anything. But with the EPT, which is the external pulse transmitter, it can affect things. But just putting it over the implant itself, it's not going to do anything.
My suggestion for my listeners, and like I said, I am in a bunch of groups with people, and they voice their frustration all the time that they don't feel heard, that they're not, they just feel like I'm giving up because if they don't care, why should I care? A lot of them get addicted to drugs, being on this. And Tori can vouch because she's seen all my medical stuff, is that I've never taken the very first pain med for any surgery I've ever had, and I've had over 100, which is quite scary. Because I've always had to be ready for my daughter. And on top of that, I'm so, you can't ever say you're used to pain because it's not a pleasant feeling, but I've never been drunk. I've never done anything of marijuana or anything like that. And I'm not saying anything to the listeners who have, but I've never taken the first pain med because for the longest time I was a single mom and I had to be ready. My daughter has special needs. So, with that being said, this is a huge option that I think people should consider, and that's why I said what I just said, is because this is something that people really should take into consideration. For those that are like, well, I don't feel like I was heard. Well, you know what? I didn't feel like I was heard with my second and third implant because it fell out both times, both within like not even a week and a half of the implementation of it. And one was done in the OR. One was done in the doctor's office with a resident. And then I would just say that, when I was conveyed that this was an option and that this would be, implanted and it was not going to be temporary and it would be a different company. And then they told me it would be the company I originally started with. I felt better. I felt like I had other options here. And then, I hadn't had the pleasure of working with Jen or Marissa yet, but when I found out it was Tori, I was excited because it was like her and I, and, she can say she doesn't, but I'm going to say it's just because it was me. But Tori and I bonded so well the first time, and we got along so well, and she never showed her frustration. She answered every question. If she didn't know the answer, she went out and got the answer. I couldn't tell people. I mean, I even went to her supervisor and told them that she needed a promotion. She needed, a paid vacation. Just saying.
She got one. She got a promotion. Let me tell you, I promoted her just a couple months ago. So she did get it was hers.
She needed it because, she's one of those people, like, everybody wants to call and complain about bad service and bad this and bad that. And I'm like, no, I'm one of those people that if they go above and beyond, I'm going to go with them and say, this person needs recognition because they changed my outlook on things. And Tori changed my outlook. And when she came around that corner, she's so bubbly and she's so cute. And, she's like, oh, I look like, I don't want to hear it. And she comes in there and she's just like, all right, let's talk about what we're going to do. And, and here you are about to go in for this other surgery. She doesn't let you feel scared. You're going in, you know what's going to happen. You're going to be, of the conscious state. And nobody goes into surgery and looks forward to it. Nobody wants to say, hey, I'm free today. Let's just go cut me open. But to know that you have the professionalism of my team, which is the 3 ladies I have here, is amazing. And for them to even offer to come on and do this is just showing how amazing they are. And they're way above any competition that's out there, that I can say hands down. But they're understanding, they're compassionate, which makes a difference when you're going through this. It absolutely, hands down, makes a difference because it feels like you matter and you're heard. And that I want to say thank you for the individuals out there that are contemplating this. I would say go and check out the STEM router. I'm going to have all of the websites and all of the information links on when I air this so that you guys can go directly to it. But tell everybody the website link as well as I'll also have it out there for them just to click on directly.
Yeah, if you go to just stemrouter.com, that's the Bioventus Bioness product. And in there's physician finders, the patient, all the information you could want. And you can also contact and ask questions, and they'll hook you up to our customer service, who will then refer you to us if you have any questions also.
And like I said, I've had them where the adhesive is so painful, my skin would be, raw by the time that it came off. I was hesitant about it because I'm allergic to Tegaderm, which is a type of tape. But these guys have been so phenomenal. They're like, oh, no problem. We're going to bring this and you don't have to worry about that. And then they go through every tiny little thing inside and out, and they make sure. And when I came out into the PACU afterwards, both times really, Tori was just sitting right there and she's so bubbly, she's like, hey, are you ready to learn? And I'm like, what? And she's like, are you ready to she's like, come on, let's learn. And we had complications in the beginning for a minute. And it wasn't because of the system. It's because I've had like 16, surgeries on that area. And she's just her bubbly, sweet self. And she stood there and she waited and she contemplated, this could be going on. Let's look at this and this. And she had everything brought to me. And she was just as sweet as can be and understanding as can be. She checked on me the next day. She checked on me the day after that. She is a text away, and I know that, and so are the other ladies. And that really, really does make a difference for the individuals that are contemplating some sort of nerve, repair surgically. This is such an amazing opportunity for you to go and really research and consider. And I know that there are plenty of options out there. There are competitors out there. And I've had more than one. I've had more than one product that isn't represented here by these 3 ladies, and it was crap. And I'm sorry, it was crap. And if you have the opportunity to have the best of the best team members, which are these 3 ladies, and then you also can have the best of the best unit, then I don't think it's really a second choice, especially when you're hearing from someone who's on their second. And I'm being electrocuted as I'm speaking with you all. So I want to thank you guys so much for your time today. If there's any last minute words of encouragement or wisdom you want to share.
I'll just say real quick, Jen and Tori have just been amazing to work with. Like I said, myself as a sales rep, there are a lot of patients out there that are suffering with chronic pain and are unheard. So just being positive and knowing that there are options out there for less opioid use, and that, you can get some relief. Every patient's journey is different, but this is definitely a great option. So I am very happy to hear, Jackie, that you're feeling the relief and that you feel the support from us. And I really just look forward to having more patients like yourself. It makes my job that much more satisfying, when you can have patients out there that are actually getting the relief that they've longed for so many years. So, I'm grateful to work for Bioventus and Bioness STEM router. and Jenna and Tori are just phenomenal at their jobs. And I'm just happy to hear of your progress.
Thank you.
Thank you for all of the kind words that have been said, and to piggyback off of what Marissa said about really putting the control in your hands, and right, certain medications we don't know what there are so many different side effects that when you swallow it, we don't know which one am I going to suffer from. Am I going to suffer from one? Is there going to be something new that I don't know? Versus being able to say, like, you are in control, right? You are wholeheartedly in control.
And I totally agree with both of what Marissa and Tori have said. And I think the biggest thing is to be your own advocate and to ask the questions and to look into it. And if your doctor, like Marissa said, if they're not versed on it, they're not doing the stimulator implantation or PNS, ask them, see what you can do, because you're in control of your own care. And I think that's the biggest thing to remember, is that you can ask the questions.
Ladies, I cannot thank you enough for taking this time today. I'm going to make sure that everything is linked in when we put this out there. And again, I just want to thank you so much. And to our listeners, contagious smile, every smile tells a story. You are not alone. Your light does shine, and you need to not give up on yourself, because you're worth fighting for. Again, I thank you so much, and I hope everyone has a great afternoon.